Today, the topics covered in this session will be to gain knowledge and understanding of the Strive for 5 guidelines, better understanding of cold chain management processes and requirements, emergency readiness in the case of disaster, and correct procedures for vaccine storage. Now, I understand that it's dinner time over here in Perth and it's been a really hot day. So what better way to get started than have a quiz? And I'm going to hand over to Jodie. Jodie, you're on mute.
Oops. Oh, well, source. So my job tonight is to get you all limbered up and all ready to answer some questions and ask some questions as well and to listen to Adele. So first question of my quiz tonight, and if you could just pop some answers in the chat. What's the optimal temperature range for your vaccine fridge? We've got a 5 degrees, a 2 to 8, 2 to 8. Okay, you guys definitely know what you are talking about. Excellent. So I'll wait for a couple more answers to come through, but just quietly, none of you are wrong. Between 2 degrees and 8 degrees, and our optimal is 5 degrees, and that's taken from your Strive for 5 guidelines. Okay, so question number 2, what should your vaccine fridge look like, A or B? Just quietly, if anyone puts A, you need to leave the webinar now. Excellent. No domestic fridges, beautiful. Great answers, guys. Okay, question number 3. How often should you check your fridge temperatures? Okay, so majority of people are coming through with twice daily. Definitely twice daily seems to be the answer. Twice a day and have a clever logger, that's a good one. Or more if there's a 2 days, twice a day or more if there's a breach. So the Strive for 5 will tell you twice a day, preferably at the start and at the end of your day. You should be checking your min-max temperature and resetting your fridge. Your data logger is ideally downloaded once and read once a week, but obviously more in times where you're concerned or worried about your fridge temps at all. And if you are a long day clinic, so you're open for extended hours, it's always a good thing to check it maybe 3 times a day. If you are a 24-hour clinic, 3 times a day minimum. Okay, and my last question for the night is, who is responsible for cold chain management in your practice or at your place of work? So we've got practice nurse, nurses, everyone, practice nurse. Okay, so my answer to this one is everyone. So, but while Strive for 5 suggests that one person be responsible with a backup person for when the main person is on leave or unavailable, we recommend that cold chain should be the responsibility of absolutely everybody. Reception, management, doctors, nurses, and everyone else need to understand the importance of your cold chain. You never know when you're going to be the one to ask to help. So most important for everybody. But now that I've stressed your brains out and it is dinner time, it's over to Adele.
Thanks, Jodie, and good afternoon, everyone. Thanks for that quiz, Jodie. It's good to see everybody's jumping on with some answers that I think some of the content in the next few slides you probably will know, but it's a great refresher, and we do know that lots of new nurses are coming into general practice and organisations, so it's a good reminder for everybody to be trained in the practice. Strive for 5 refers to 5 degrees Celsius, the midpoint between 2 degrees and 8 degrees Celsius in your vaccine fridge. This is the recommended temperature range for vaccine storage. The National Vaccination Storage Guidelines strive for 5, which I hope you've all got a copy beside your fridge, at your desk, and everybody's aware of it and everybody's read it. The guidelines provide information and advice for vaccine storage management for all Australian immunisation service providers. Many vaccines can be damaged or destroyed outside this range. The Strive for 5 guidelines describes the best approach to ensure that patients receive effective and potent vaccines. They describe the cold chain and provide advice on what should be done in the event of a cold chain breach. These guidelines have got really useful resources such as checklists, charts, posters, and stickers. The guidelines apply to vaccines stored in a purpose-built vaccination fridge. The cold chain is a system of transporting and storing vaccines within the safe temperature range of 2 degrees Celsius to 8 degrees Celsius. All vaccines must be always stored within the recommended temperature range of 2 to 8. Maintaining the cold chain is important to ensure that effective and potent vaccines are administered to patients. The cold chain is a system of transporting and storing vaccines within the safe temperature range of 2 to 8. The cold chain begins from the time the vaccine is manufactured, continues through to the state or territory vaccination distribution centre and immunisation service provider, and ends when the vaccine is administered. Vaccines must be protected from light. Vaccines may lose potency if exposed to direct sunlight, ultraviolet light, including fluorescent light. If a vaccine loses potency, it may become less effective in providing protection against vaccine-preventable diseases. To protect vaccines from light exposure, they must be stored in the purpose-built vaccine refrigerator that we saw a picture of earlier, and inside their original cardboard packaging. Vaccines must not be removed from the original cardboard packaging to increase vaccine fridge capacity. The original cardboard packaging ensures vaccines are protected against exposure to sunlight, ultraviolet light, or fluorescent light. They're protected against temperature fluctuation, possible breaches, tampering, or vaccine administration errors. Twice daily minimum and maximum temperatures must be recorded as a timely alert to any breach. With your vaccine fridge, ensure vaccines are stored in a purpose-built vaccine fridge. They're in their original packaging and they're stored in open weave baskets with a solid base. Do not put vaccines at the bottom of the fridge on the bottom shelf, and do not overstock your fridge. So what is a cold chain breach? A cold chain breach is exposure of vaccines to temperatures outside that recommended range of 2 degrees to 8 degrees. A cold chain breach may be referred to as an adverse vaccine storage event. All vaccine temperatures recorded below 2 degrees or above 8 degrees must be reported to your state or territory health department. This does not include temperature deviations in which the temperature reaches a maximum of up to 12 degrees for 15 minutes or less. This may differ in some states. Any deviation below 2 degrees must be reported. And I'm going to repeat that, the really important, any deviation below 2 must be reported. With private vaccines, you refer to the manufacturer of the private vaccine. Data loggers. Data loggers are small electronic devices that measure temperatures at preset time intervals. They record the results over a period of time, and they should be set to record temperatures at 5-minute intervals. All staff should be trained in how to operate and manage the data logger and translate the readings. Place the data logger where it's easily seen in the middle of the vaccines. Measure the current minimum and maximum temperature twice daily or 3 times daily if you're extended, and record them. Set the alarm system to alarm outside the 2 to 8 degree range and check that the alarm is working. Train all staff at your organisation or your general practice to recognise the alarm and download information from the data logger. Download and record information as soon as possible after the alarm is activated. If recordings are outside the 2 to 8 degree range, follow the cold chain breach protocol and notify the relevant state or territory health department. Check and record the accuracy of the data logger. Record the date the accuracy check is done. To check the accuracy, place a second data logger in the refrigerator next to the existing data logger to obtain comparison temperature readings. Inbuilt data loggers should be checked for accuracy according to the manufacturer's recommendations. Change the battery according to the manufacturer's recommendations or when the battery life displayed on either the data logger or computer setup screen is low. Record the date the battery is changed. Life of the replacement battery may be dependent on usage, so how frequently the temperature is recorded and the data is downloaded. Vaccine wastage must be reported. To report a wasted incident due to vaccine expiry, user error, or any other reason, refer to the information within the vaccine incident form or contact your public health unit. Each vaccination service must have written policy, procedures, and protocols in place to ensure efficient cold chain management. Orientation to all staff, all current staff, and all new staff must be given and include the vaccine management protocol. Audits. You can carry out a self-audit at any time. If you see any fluctuations, you can carry out an audit. So from 2023, an annual audit from the Department of Health will be carried out with your vaccine order. Managing a cold chain breach. Follow the cold chain breach and the vaccine storage guidelines strive for 5. Immediately isolate the vaccines and put a sign on your fridge, do not use. Do not discard any vaccines and contact your state or territory health department as soon as possible during business hours. Private vaccines refer to the manufacturer. If necessary, in a cold chain breach, prepare to transfer vaccines into temporary monitored vaccine storage and transfer if required. Now I'm going to hand over, we're going to watch just a 2.5 minute video on packing an SD. hopefully most of you got to see that video. If there are any questions about cold chain management, cold chain breaches, please pop it into the chat, and if we've got time at the end, we will endeavour to answer them. I'd love to pass over now to Lisa George. We're very lucky to have Lisa George with us tonight. Lisa is our Programme Coordinator for Disaster Preparedness and Planning. Thanks, Lisa.
Thanks for having me, guys. It's really exciting to be here and be part of such an important presentation led by two immunisation superstars, Jodie and Adele. Thank you to Emma for leading the way. My name is Lisa George and I am the Program Coordinator for Disaster Preparedness and Planning at WA Primary Health Alliance. I moved to Perth after 10 years in regional WA, including places like Roebourne, Exmouth, Karratha, Geraldton and the exotic Marble Bar. My role at WA Primary Health Alliance is to deliver the GP Emergency Response Team project, and information about how you can engage with my project will be available at the end of this presentation, so a bit of a shameless plug. I'm here to provide insight into what could impact on your cold chain management system and help you to plan for both the predictable and unpredictable hazards. So the reason you experience a disruption to your cold chain management could be both predictable and unpredictable. In the next slide, I share with you 28 prescribed hazards of Western Australia, which is an image you may or may not have seen today. With this information, you'll be able to build a better cold chain management system as your planning will consider a broader list of risk factors. The image that you see on the screen is what is described as the WA prescribed hazard, and each state in Australia has a list of prescribed hazards. So it's a profile of, I guess, what the biggest risks to each state are. The West Australian state risk profile has been developed from an assessment of WA and lists 28 prescribed hazards, including natural and human-caused incidents. Here you can see the list of 28 hazards identified for WA, which include natural hazards such as cyclones and fires, as well as floods, but also less commonly known hazards such as terrorism, fuel disruption, and space debris. So planning is specific to single hazards, but will also consider all hazards. This refers to the consideration of all 28 hazards that you see as opposed to any single one. Can I just confirm that everyone is seeing the image of the 28 prescribed hazards? A couple of thumbs up. We've got a nope.
Yeah.
All right, we've got a yes. All right. Sorry for pausing there, and I'm sorry for those who can't see it. Perhaps it might be a case of logging out and logging back in. It might be a problem with your IT on your end. Thank you, everyone, for your responses. So, one of the examples of the hazards in Western Australia, if you can see over here, is power disruption. And just recently, we had a significant power disruption in the goldfields. The effect of that to 6 GP practices in Kalgoorlie were quite significant. And the power outage occurred on a Wednesday evening at 5:30 p.m, which is obviously unstaffed and non-operational times. Staff were unavailable, or some staff were unavailable, or they were processing their own personal challenges. Temperatures were also high at the time, and many staff were at home dealing with their own challenges. Now, one of the practices did have a generator in place. However, my understanding is that they were unable to access additional fuel because when power goes out, fuel cannot be pumped. There were some places that had battery backups, but unfortunately a few of those failed. And practices lost significant amount of vaccines and medications, including some that were privately purchased. As a result, there are in excess of 900 appointments that were impacted on one day alone, or 1 or 2 days alone, and it impacted on the delivery of primary healthcare in the short and mid-term for the region. So the Kalgoorlie power outage was a really educational process for Kalgoorlie, but also very, very challenging. So from the Kalgoorlie incident, we can see that there are a lot of variables for you to consider in your planning. So the more you learn about the hazards as they relate to Western Australia, the better you can prepare. Now, I understand we don't just have Western Australian staff on the call. We also have some other states present. So you'll see I've done my best at finding the most up-to-date hazard information and profiles for each state. You can see on the screen, which they're not very clear, but we've also got the links to these in the resources at the end, that Queensland, Northern Territory and Tasmania have their own unique risk profiles, as well as New South Wales, the Australian Capital Territory. So those links should take you to your state emergency management plan, and hopefully the most up-to-date one if I've done my job well. And in those plans, you'll be able to identify what those key hazards are and plan for those for your cold chain management. So how can we best prepare ourselves and our plan with this new knowledge? Firstly, you should understand your state hazard profile, so click on the resource link at the end of this presentation. Secondly, plan for varying disruption lengths. Try not to be overly optimistic and think that this power outage is only going to last 2 to 4 hours. In the goldfields, it was a few days that people were affected, and I know that during the Malakuta bushfires, they were out of power for a couple of weeks. So consider short-term planning, mid-term planning and long-term planning. Also consider after hours, night, weekends and public holidays, including Christmas Day and any other public holiday you would prefer to be sipping champagne with your feet up by the pool, because often disasters happen on a Friday evening or on the weekend. Now, what's really, really important is that with your cold chain management plan, you need to train everyone in your team, and that includes your new staff. So as staff leave and they are replaced, make sure that part of your induction includes the cold chain management plan. As always, test your plan, and then after every incident, I would love for you to review and improve your plan, because each incident gives us new challenges to consider, and we can go in and improve our plan. And finally, document the activity that you've taken to plan for your cold chain management as part of your QI activities. Now, like I said at the very beginning, my role is to deliver the General Practice Emergency Response Team project, and I've just noticed there's a QR code which you'll be able to scan and register to attend. You'll be able to learn further information about the General Practice Emergency Response Team project on the 18th of March. And if you have any questions, there's an opportunity to ask questions, which Jodie will be leading in this next slide. Thank you very much.
So I've answered quite a few questions. There is one that has just come through that I will put to the group, which is, when we had a cold chain breach last year, we followed the Strive for 5 guidelines, transferring vaccines into a pre-cooled eskies as we were told the power could be off for several hours. When the nurse contacted CDC, she was questioned why she transferred the eskies and did not leave them in the fridge. When I followed this up with CDC, I was told too many vaccines were being frozen, so it might have been better to leave them in the fridge. Can you please comment on this? Del, do you want to take that one?
Thanks, Julie. Yeah, great question. It is recommended that you follow the Strive for 5 guidelines, transferring vaccines into pre-cooled eskies. It is recommended that you leave the vaccinations in the fridge, and if you're transporting them to another vaccine, so if you were going to the hospital, let's say, for example, in country, if you were going to the pharmacist down the road that again may have power outage, that you transfer them into an esky with the video that we showed you.
Other than that, most of the other questions all the other questions so far have been answered. Does anyone else have any other questions that they would like to ask Lisa or Adele or myself? Got a really quiet audience.
Like we said, there will be a list of Q&A that we will send out with the certificates of attendance, the webinar recording, and some really useful resources. Yeah, we'll send that out. So please contact us if you have any further questions following this webinar. You have 3 o'clock in the morning thoughts that you didn't answer. If something happens in your organisation, your general practice, you know, in the near future, please feel free to contact us.
Adele, there is another question. Are there any ongoing immunisation update courses available?
At this moment, we're not sure if we're rerunning the immunisation reimbursement course, the South Australian reimbursement course. If we do in the future, please look on Practice Assist, subscribe to our newsletters. Any information and any further courses will be in our newsletters or Practice Assist.
There was also a question about whether or not the health department was going to be doing that annual update, and I've just answered that and said yes, they will be. It'll be in the next couple of months. It'll be just before the flu season comes out. I don't have a date for that as yet, but it will be, my guess is probably early April. Then we have a question regarding vaccine breaches. So with regards to breach labels of the vaccines, how many sticker labels on the vaccine packages are allowed to be used again? I'm not 100% sure on that one. So are you talking about how many times that particular label can be used, or how many times the vaccine can be used? Anne, would you advise GP sites or health sites to devise an emergency plan for cold chain outages? That's one for you, Lisa.
Hi, Anne. Yes, absolutely. There's an emergency response planning tool available online. I'll find the link for you and I'll pop it in the chat. Hopefully, GPs and clinics have completed an emergency response planning tool, which helps them to consider their business continuity in these types of situations. And yes, definitely include cold chain considerations in that plan. I'll hop off and find that link right now for you.
And then we have another question which Adele can answer. How long can you leave in fridge before transferring an esky for extended power outage? So how long can you leave the vaccines in the fridge before you have to transfer them? Is this greater than 4 hours?
I'm not going to answer that one yet because I just don't on the top of my head have got the answer there, but we will follow it up. Jodie, I know that you can leave it in the fridge, but you would need to follow the guidelines from your public health unit.
Anybody else got any questions? Okay, so we have another one that says, I have a log tag that is recording temperature. The probe is in fluid. To test this functioning, I can only use a log tag that sits in the fridge, so the probe does not sit in the fluid. They will always differ slightly in temperature recording. So how can I check the function of the log tag with the probe that sits in the fluid? Good question, Deborah. And I'm not 100% sure on that answer, and I don't think Adele will be either.
No, that's a good question, Deborah.
Yeah, Deborah, what I will do is put that to the gurus at CDC, and I will get an answer for you, and we'll include it in our Q&A resources that we send out to you later on. Any other questions?
Please keep them coming, and we'll try and answer them, you know, throughout the webinar or follow up. Thanks, Emma.
No worries. Well, I just would like to thank Adele and Jodie and Lisa for doing an amazing job presenting. And you feel free to continue to put those questions into the chat. I'm just going to shamelessly put the links in for the other webinar, immunisation webinars, so that you guys can check them out if you have other questions about immunisations. And I'm just going to put in the link again for the emergency management webinar as well for you there. So moving on, just a reminder about our upcoming webinars. We're going to have one on updates and new vaccines and changes. I think probably all of you in general practice are aware that there are just constantly new changes and new updates. And so that's a very timely one for you guys to attend on April 25th. Look out for the advertising and the links for that when it comes back. We also are going to have one on Aboriginal immunisation and cultural sensitivity on June 20th. So look out for all of that as well. Just a reminder that we are going to send out the resources and links to you, and we also are going to send out a Q&A. We'll transcribe all the questions you had and all the answers, and we will also track down answers for you that we may not have had. And you also get a really shiny, fancy certificate that I'm sure you'll want to print and frame and put on your fridge or somewhere very exciting. So that's coming to you. April 25th is a public holiday. That is a good point. We may change the date then. Thank you, Kirsty. Thank you very much. Good call. Keeping us straight and honest. Okay, I also want to make you aware of some other resources that are available to you. We have the Health Pathways WA. It's a secure online portal for general practitioners, providing clear guidance on best practice, accessing, managing and referring patients across WA. Although primarily written for GPs, the portal is accessible to all health professionals registered to practice in WA. To find out more, you can head to the WAFA website, and you can also request access by heading to the website there. If you'd like to pull up your phone and go through the QR code, that's there for you as well. Just to let you know, there is a health pathway on vaccine storage and cold chain breaches, and that has heaps of resources and heaps of links for you as a medical professional, and you just have to search vaccine storage and cold chain breaches. Next, we have Practice Assist. Practice Assist provides support to general practice. The help desk is available via phone and email, Monday to Friday, 8 a.m. to 5 p.m. You can visit the website for information and resources and support about general practice in a range of topics, including immunisation. They also have a very handy fortnightly newsletter called Practice Connect, and that is produced featuring immunisation each edition. So please ensure you subscribe if you're not currently receiving this.